the turn up on the books. My name is Willem-Jan Renger. I am a partner in the SOCIO BEE project as part of the Utrecht School of the Arts, and I will have the honor of being your host for the small periods of time where we have to explain things before handing over the floor to others. We welcome you on behalf of two European research and innovation projects called SOCIO BEE and CitiObs. Both of these projects have a number of things in common, despite their different approaches. The theme of today is about air pollution and what we can do to activate citizens to liaise to this subject, to actively interact with the subject, to become involved and become proactive. And we have followed different strategies. We are at a stage where we have lots of lessons learned, which we really want to share, but also discuss with you as an audience. Therefore, we created this event. Again, we are very pleased with the turn up. I will explain later a bit about the program. We have a series of items combined today. It will be, it's quite, for us at least, as organizers, it's a bit of an ambitious format. We are trying different tricks. We use different platforms. There might be moments where it seems confusing or there's a bit of switchology. Bear with us. It will be okay. And if you have questions, please ask them in the chat or through live voice. We will sort it out. First, as I said, we'd like to welcome you. We have a very, very special speaker, which I'd like to introduce to you later. But before we start and explain the program and what we are going to do, we'd like to ask you a couple of questions so that we know a bit better who we have in the room, for which I'd like to switch to Karen Ekman from NILU as one of our partners in crime, I would say. We will be using a Menti questionnaire. If you're not familiar with this, you can use a smartphone or your device to go to this URL, and then when you're on that site, you can have the ability to provide a code. If you provide the code as is mentioned here, the 6928417, automatically you will be part of an interactive session. It's quite easy. So take your time, maybe use your smartphone or use a browser, whatever is convenient for you. And we can, at least Karen can see in her side of the dashboard if you can make it into the Mentimeter session. So I hand over the floor to Karen.
Thank you. And if I can share my screen, is it possible? So here you can see also if you can't log in through menti.com, you can also use this QR code for logging in, and I will, or use the code at menti.com. So we want to ask you some questions about your roles and previous experiences in citizen science and air quality monitoring. So if you are in, please start answering the questions. Will be interesting to see. Most of us are experts or researchers of some kind, but we do have some citizen scientists or interested members of the public, policymaker, NGOs or technical providers, etc., and some with no prior experience. That's fine. So I will wait for a while, and then we will turn to the next questions. So it seems like the registrations have stopped. No, some more questions. Good responses. And the next question is, your previous experience, and those are related to the themes of this workshop. So if you have experience in working with data quality, data-driven policy, standardization and interoperability, accessibility and scalability, air quality sensors, personal stories such as lived experience and other soft data, or equity and inclusivity would be really, oh, this is interesting to see who you are. Quite a broad field of experiences here, that's nice. We'll wait a couple of more seconds before we end the show, but it seems like a lot of people have experience in different kinds of this workshop. So I will stop sharing now and we will come back to more questions later on. Bye for now. I stop sharing.
Thank you very much, Karen, for this brief getting to know you in the large numbers that we have in our online environment. So before we proceed into the program, I'd like to tell you a bit what we are going to do. We are currently in the welcome, but our next station is a very important one for us. After I've shared the program with you, I'll give a proper introduction to her. Rosamund Adoo Kissi Debrah is among us, and she has a very, very special story to share with you. After that, we'll have a brief summary of the two projects hosting the session. The SOCIO BEE story will be captured by Evert Hogendorn, my colleague at HQ, and CitiObs will be brought to you by Nuria Castel from NILU as part of the CitiObs consortium. Then we'll have a short break to have a drink or the bathroom or whatever to refresh your minds. Then we go into the World Cafe. This will mean that we do some funky switchology. We have 3 breakout rooms, as they are called. We'll split you into 3 groups. We have 3 themes that we want to discuss with all of you. So this World Cafe will be a rotating cafe. We'll have 15 minutes to share experiences that you can bring to the table and discuss these topics. You stay in your room, and we as moderators will rotate among the groups so that in the end you have shared your experiences on all 3 themes. And then we come back together in the main room for 15 minutes of harvesting the results. For this World Cafe, we'll use a Miro board for you to be able to put in experiences and stickies with your own thoughts and ideas so that we can capture the group experience. As we have seen, it's a wide range of knowledge and experience that we have. So it becomes interactive. It's not just sending from us our experiences and lessons learned, but we'd like to discuss them with you in an interactive way. And then we have 5 minutes of conclusion that will end the session. So this is a bit of a preview of the whole exercise. And then it brings me to introducing to you our special guest of today. As I said, we have from England, Rosamund Adoo Kissi Debrah, and she has a very special story to tell you. And I can't tell you how privileged we are that she is willing to give her time and her story to us as a group. She is chairing the Ella Roberta Foundation, and the true star of today, I believe, is Ella. And unfortunately, she is no longer with us. Ella is the daughter of Rosamund. She passed away in 2013, if I remember correctly. She was 9 at the time. She suffered from asthma, but her condition was severely affected by air pollution. And in honor of her and an activity of a very special kind, Rosamund has stand up and has become an activist to fight for recognition of the importance and its implications of air pollution in a wide range of activities she has deployed through her foundation. Special mention is Ella's law. She is fighting to get a law accepted in the UK where the UK should adhere to the WHO standards of air pollution measurements. At the moment, in the UK, the accepted levels of pollution are twice as high, I believe, than the WHO standards. Rosamund, you have to correct me if I get things wrong, but I think the law is being passed through the houses, has not been accepted yet, but who knows, there will be elections soon, and I have a feeling that it might speed up the process of acceptance of this law, possibly. She's campaigning and doing all kinds of advocacy. She's supporting educational activities and initiatives, maybe like our project, with citizens, a lot of community engagement, and she's working on memorial projects for Ella to keep her memory alive and yeah, make that a cornerstone of change. So again, I can't tell you how privileged you are, Rosamund. You're here to tell your impressive story, and I'd like to hand you the floor for 20 minutes to take us on your journey on this important subject.
Good afternoon to my friends in Europe, and good morning to Great Britain. And today is election day, so I will do my best not to encourage anyone who to vote for, but just to encourage my fellow citizens in the UK, please exercise your vote. It is very, very important. I have decided to name my speech for today. I went to a conference in Manchester. It's called WOW, Women of the World. And I saw this poster, and the poster read, "One girl can change everything." And for my speech today, I decided to give it that title because I truly believe, as much as a mother, it breaks my heart, I have lost my daughter. But I think I now have to accept that Ella has really changed the course of how we view air pollution. A bit of background story to give you. I am a mother of 3. Ella is my firstborn, and I have twins as well. And I think what's very, very important for this discussion is people understand that none of my children were born with asthma. And Ella didn't get her asthma till she was almost 7. So she became ill in October 2010 when she was 6 years and 10 months. And I think that's really, really important to say that. Also, it's very important to point out Ella was a very well child. So if you look at her medical records, that apart from her apart from her jabs, her vaccines, there is no record of a child who is always in and out of hospital. And I think that is very, very crucial to actually say that, because the moment someone says Ella had asthma, the assumption is she was born with it, but she was extremely healthy. Ella became ill. I'm not even going to say chronically ill. She became ill initially in October 2010. And this presented as a cold. And we know a cold is very synonymous. Lots of children have colds, and it's not something, as her mother, I was even bothered about. She had a cold. But she also had a cough. Many children have coughs. So again, I wasn't bothered about. But when she was given medicine initially, the cough did not disappear. So we went back to the GP, the local doctor, and she gave us some more medicine. But it was very interesting. When we went back again, her GP, who was very experienced, I must add that, said, I need to refer her to the hospital just to check her over to make sure she's okay. Ella had her first appointment in hospital in November 2010. And they didn't really know us. And I think when we went to the GP, she still had, when we went to the hospital, sorry, she still had a cough, but it was nothing they were really worried about. Unfortunately, this cough never went away. And it was later diagnosed as coughing syncope. So what Ella would do is she would cough and cough and cough and cough till she would cut off her oxygen supply. I'm talking about in hindsight, because initially when she did it, I didn't know what had happened to her. So Ella had her first seizure. So she became ill in October, and by December 2010, she was in her first coma. Her first coma was 21st of December 2010, and her second coma was a week later. Ella was in a coma, I think, at least 5 times before she died. And all those times, she managed to bring herself back around again. It's very important to say Ella had one of the worst cases of asthma ever in the UK. Ella's asthma was very severe, but very rare. And it's very important for me to say that because lots of people have asthma. And it is never my intention to scare, especially when I go into schools, because lots of children can identify. So I always had to say she had severe or brittle asthma. So if we have any scientists here, they will know what I'm talking about. When Ella died, or during her lifetime, we never found out what her triggers were. We didn't. She would start coughing. She could be watching television and she would start coughing. And you would look around the house, you would try and find out what it was. You couldn't find out. Initially, I even thought it was something in my house until she went to hospital. Then she did the same thing in hospital. And she would cut off her oxygen supply, go blue, and then you have to resuscitate her. Ella ended up going to hospital almost 30 times in her short life. So she wasn't actually ill for 3 years. She was ill for 28 months. And she went into hospital roughly 28 times. Some of it she was put into a coma. Some of it she will come around very quickly. Some of it she'll be in hospital for about 10 days. But during all her lifetime, we never got to the bottom of it. Ella had no allergies. Very important to put these things out. She wasn't allergic to dairy. She wasn't allergic to anything. They tested her for epilepsy, cystic fibrosis, everything. She was clean. When she died, it took them over a year to find a coroner for her first inquest because her medical files were huge and they needed to understand, we needed someone who could understand what was going on with her. At the first inquest, the conclusion they came to, they knew her triggers were to do with something in the air. They didn't know what that was. So let's be very honest about that. And also, we realized she was a very sick child. The pathologist who examined her, when he opened her up, he said Ella's chest looked as if she had been smoking. And I think that's very, very important for people to understand that. All her lungs were black, but also all the x-rays did not pick this up. So it wasn't until they opened her did we see the full extent of her damage. As her mother and as a teacher, I knew there was something suspicious about this. You can't have a healthy child one moment and then the next moment, when they open her up, she looks like she's been smoking. So I knew something was not right. Someone locally, and this is where local people come into it, who was monitoring air pollution in the area, I put out an advert in our local newspaper and asked, could someone help me get to the bottom of this? So a gentleman who was monitoring air pollution told me, you need to have a look at the air pollution in your area on the night Ella died. He was right. On that night, when we looked at the monitors, the air pollution was the highest it had ever been. Her lawyer was looking for people affected by air pollution, so I went forward. And it was her lawyer, Jocelyn Coburn, who pinned down all Ella's hospital admissions. She got the monitoring from the station and she linked them together. And every time Ella went into hospital, there was a spike in air pollution. And that's how we put her case together. And for those cynics as well, I think it's very important to say, we also took samples of Ella's body when she died, which were left in the hospital. And our expert witness, Professor Holgate, did go to Great Ormond Street and with the pathologist, underneath a microscope, they looked at Ella's tissue sample and they found PM 2.5 all over Ella's body. So not only did we have the correlation of the spikes in air pollution, we also had scientific evidence. So we wrote to the coroner to quash the inquest and to give us a second inquest. We had to fight for this. It took the Attorney General 6 months to come to his conclusion, but he gave us a second inquest. And on December 16th, 2020, Ella made history. She became the first person in the world to have air pollution on her death certificate. And when you look at her death certificate now, as of for today, it says Ella died from excessive air pollution. So not just air pollution, but illegal levels of air pollution. It's very important for your audience to understand, during Ella's lifetime, there was illegal levels of air pollution, not just on one of the busiest roads to where we live, but all over our borough where we lived. And also, can I please say, Ella is not the only one where I live to have asthma. She's not unique. We have one of the highest rates of asthma in the UK in the borough of Lewisham. Ella was very unlucky, but I feel if it wasn't her, it would have been another child. The coroner, in his verdict, what he said to the UK government, and if the Prime Minister-to-be is listening, or he will hear this, his instruction was, unless you clean up the air, more children like Ella are going to die. And it is very, very, very important for all governments everywhere to understand that message. The coroner also came to the conclusion, monitoring is very, very important. So people need to know what they are breathing in. And policymakers, please do not keep that data. You need to share them with the public, because the coroner concluded raising awareness was also very key. And the third thing the coroner said, which should apply to health professionals everywhere, they all need to be educated about the impact of air pollution on health, and they need to talk to their patients about dirty air. We now know, since 10 years since Ella died, air pollution is linked to all non-communal diseases. It is linked from low birth weight, stillbirth, strokes, lung cancer, heart attacks, cognitive decline, Alzheimer's. Even in pregnant women, they have now found PM2.5 in the placenta. We also know with dementia patients, they have found PM2.5 on the brain. So it is very, very important we take this moment. I've been watching across Europe with elections going on, and I am very sad to find out that things like net zero, there is a backlash against it. I feel that we are partly to blame, by the way, because I feel we have not educated people enough. We haven't stressed enough to them the dangers of air pollution. People don't need to be lectured, but we need more stories, personal stories like me. We need people to come forward who are impacted by air pollution. And I think personal stories are very, very important, but not just stories. We need scientific evidence as well to back up the stories. WHO, who I am a Breathe Life ambassador, we know every year 7 million people die prematurely from air pollution. And in that figure, what's even more worrying is 500,000 of that figure is children before the age of 5. So what we can learn from Ella's story is we are all breathing in air pollution, but there are some who are more vulnerable than others. Some like children, some like older patients, the elderly, they are impacted more. And before I end, may I stress to everyone listening, we had a pandemic, COVID, which was airborne. COVID is like air pollution. Air pollution is airborne. And we now know in areas of high air pollution, not only did more people die from COVID, they got COVID more severely. And we know how horrendous some of the symptoms of COVID were. I feel COVID is a warning. And Ella was a warning. Ella was the canary in the coal mine, telling people what is to come if we do nothing about air pollution. We cannot afford to do nothing. Otherwise, those figures of 7 million will end up being 8 million, 9 million. If we do nothing, more people will unfortunately die. So I stress to Europe and to the UK to take this message seriously. People are living longer, but they are living with awful conditions. We need clean air, clean water, and clean food. And what I mean by that is pollution, we now know, is even hitting our soil. So to the policymakers, to governments, to leaders, stop lying to people about net zero. You know, and I know, based on scientific evidence, that air pollution kills, and may another child never have to go through what my daughter went through. I will pause there because you don't need to hear me talk all the time and people can ask questions. Thank you for having me.
Thank you so much, Rosamund, for this incredible story. Fortunately, as projects, we already knew how important it was to go on the barricades and do something about it. But this dimension, this personal story, and the sacrifice is putting even more emphasis on that mission. So you're really reinforcing our cause. If I was not convinced already how important it was, you sure made a point in that importance and the efforts we have to put in. Also to spread, I think, the message and involve more people, more citizens to be aware. From a personal point of view, we are in our SOCIO BEE project. I worked with my colleague Evert on material for citizens. And the first thing that struck me was the invisibility of the problem. It's like a silent secret killer, right? So we made sure that we addressed that. But it leads me to my first question to you is, how do you think we can strike a balance? And this is also something that was put forward by our peer reviewers in our project. How do we strike a balance between, let's say, activation and awareness versus the ability to scare people? As you were very eloquent and precise in framing the cause of Ella and the origin of her disease. Like you mentioned, if young people have asthma, you don't want to scare them that they might be next, although they are at risk. What would be your advice how to strike that balance?
As a teacher, you must always be honest with your subjects and your pupils.
Mm-hmm.
We know the impact air pollution is having. I think why I am not scared to say anything about it is people are already ill. In the UK, I don't know, obviously, all your separate countries, but you can imagine I have all the figures for the UK.
Yeah.
8 million people are currently on the waiting list in the UK, waiting for treatment. When I was younger in school, cancer was 1 in 9. It's now 1 in 2. So you don't need to scare people. They are already ill. But people want to be told what to do, but they want honest information, and the messaging needs to be very strong. So we need to learn from COVID, where the message was wishy-washy. We didn't know what we were doing. I think people appreciate being honest and telling them the truth. So some health professionals asked me once regarding pregnant women, should they tell them about the dirty air they were breathing when they found out the PM 2.5 in the placenta? And I said, yes, tell them, because they're already pregnant. Now, some of them might be able to move, and you need to give them that choice. I think what people do not appreciate is when you hide information and you tell them later. We don't need to scare them. You know, so in the UK, 36,000 people die prematurely every year from air pollution. We are a country of 65 million. So I didn't say to you 65 million people die, I said 36,000. And what that works out to is in every classroom, I think 1 in 3 children has asthma. So our classrooms are made up of 30 students. So that tells you 27 do not have asthma. But it's better to be honest with people. I've noticed honesty goes a long way. And when I meet people on the streets, they are very grateful for me being honest. You don't need to scare them. You need to tell them the truth. There's a slight difference between the truth. I believe if we tell the truth, we need the public to put pressure on the politicians. So if we don't tell them the truth, then they can't do that. But there's no point scaring them. Well, what would be the point of that? There is no point. You just have to tell them the facts scientifically as we know that. And from a scientist, I think that's okay.
Yeah, I fully agree. Is there any other person present that would like to ask a question now? Rosamund is still with us to be able to answer them. You might want to put it in the chat or raise your voice and put on your microphone on speak, whatever you has your fancy.
Can I just say, whilst I wait for a question to come in, after the inquest, my lawyer and I decided we were not going to rest, because although we had won, we knew, look, to clean up the air is going to cost money. I don't deny that. But governments spend trillions on healthcare. And what I advocate is a preventative model. So if you clean up the air, then not as many people will get ill. So we're trying to get Ella's law through Parliament. We didn't succeed. But as I said to you, there will be a new Prime Minister tomorrow. So we're going to try again. I would like clean air to become a human right all over the world in the same way water is. And I need everybody's help, all governments, to get that through. And I think I've been told governments are not going to vote for it. I wonder why. I think governments have a duty to their citizens to clean up the air. So any government minister watching, I think you need to do what is right. The same way people have a human right to water, I believe they have a human right to breathe clean air.
Yeah. There's one question in the chat I'd like to put forward to you, and then
Please do.
We have to also watch time, how much time we ask from you. But what would be the best tip for citizens and the data they might acquire to reach out to policymakers? Do you have a sort of strategies that worked well in your experiences with citizen engagement, or is there a golden tip you can share?
I can't give the game away, but I'm working on something with a scientist. We believe because air pollution is invisible, maybe a way around it is to make it visible. So that's what I am. Oh yes, that's what I'm not going to give up on this. So my aim is to try and make it very, very visible, because it's very difficult for people to grasp the concept. It's because they can't see it. But my thing I say to people and to citizens, if you can smell it, and if you can taste it, then it means it is there. But I believe we need to find more ways of making air pollution visible to people, and we will get more. I think people are bombarded by all these messages with net zero, and maybe it's too much for them. So what I'm talking about here is health, and the coroner recognized that as well. When he wrote to the UK government, he wrote to the Department of Health, he wrote to the Environment, and he wrote to the Department of Transport. And the coroner concluded these departments all need to work together. So it's not just an environment issue, it's not just a transport issue or a health issue. Everyone needs to work together to solve it. So that's my answer to that. I think we need to try and find ways of making the invisible visible.
That is a very powerful conclusion. Rosamund, I like again to stress and thank you so much for being with us and sharing your story, and commend you for your actionability and example, and Ella's example, keeping that as a beacon of a personalized story to stress the importance. I think it is something you started with. A personal story is sometimes far more powerful than statistics, because sometimes they become too big to be comprehensible, and you have the figures and we know the data, but a personal story goes a long way. We shared the link to the Ella Roberta Foundation in the chat.
Thank you so much.
So that all the participants are aware of your work, and we'll keep an eye out. And I can personally attest that the moment Ella's law passes Parliament, I will bring a toast to you and your lovely daughter.
And I thank you also for having me and for listening to me. And I am always appreciative, because one person can't do everything. I need platforms like yours and the support of everyone. So good luck, and thank you all for listening to me this morning. I really appreciate it.
Thank you very much.
Thank you for having me.
Let's do a little applause in the online way.
Thank you. Bye.
Thank you, Rosamund. Dear audience, this is the conclusion of our keynote speaker, and I think we can agree that this is a very strong message to bring home to our hearts. Fortunately, we are not just looking at the subject, but we collectively as project worked on this subject. So right now, I'd like to introduce the two projects to you. First of all, we start with the SOCIO BEE project, and then we'll turn to the CitiObs project. The first speaker is Evert Hogendorn, my well-established colleague. He will take you on a little journey to capture 3 years of very hard work and challenges that we had to overcome, and give you a bit of an oversight what we have achieved and some of the lessons learned. So without further ado, I'd like to give the word to Evert.
Thank you, Willem. And I'll try to catch up a little bit on the time. I'm not going to tell you everything that happened in the project, but give you a brief overview of what we have been doing. First, starting with the project aims that we set ourselves in, of course, a much more lengthy European Brussels speak document, but it came down to this. We wanted to enable citizens to collect scientifically valid data in their own neighborhood, to process and interpret this data. So it didn't only state data, but really became information and actionable information. And to use this information to improve their quality of life. And this might have kind of two trajectories, could be through changing their own behavior or influencing policy making. So that's what we set out to do. And our strategy was as follows. We first developed with our partners a sensor that could actually collect this data, and this was a mobile sensor, so it didn't have to be stationary. It could be carried around and be put on maybe different transportation. I'll come to that later. So people could carry it around, take measurements, and bring all those measurements together. Enabled to have a place to steer the whole thing. We developed an Android app that people could download on their own phone. They could collectively start a campaign, set out to cover a certain area with a certain goal, so a hypothesis, a research question. Then they knew what data they had to collect, and they would go forward performing this campaign. And they can do it on foot. They can move through the city, and we also had kind of a layer on top of that, literally, actually, where we put the sensor on drones, so we could measure up higher in different areas and higher up in the air. So this was in an overview what we set out to do. We had 3 pilot cities where we conducted the pilots, and we focused on 3 different target groups. So the first group was youngsters, high school kids. The second group would be professionals commuting from their house to their job, and the third group would be elderly, having a lot more free time than the professionals, of course, but also have different usage of technology, a different relation to the technology, but also a different relation to time and mobility. We had the 3 cities. The youngsters were targeted in Zaragoza, where we did a lot with high school kids. In Ancona, we focused on the elderly, and in Marusi, we focused on the professionals. So this is what the project looked like before we did anything. Then we came up with a way to mobilize our target groups, because mobilizing each one would make it a lot of work, make it really hard to scale up, but also it would be really a lot of work for the citizen science eventually doing all the measurements on their own by themselves. So what we did, we came up with coming from our name, SOCIO BEE, a bee analogy, where the citizen science collecting all the data, where the bees more or less collecting the nectar from all the flowers, in their own neighborhood. These bees were directed by a queen bee, who would overview a group of worker bees it would be kind of the organizing mechanism, so they could collectively come up with a goal, a hypothesis, something to research, also collectively look at the data after it had been collected and draw the conclusions and come up with results and further plans. To help and to enable this queen bee, we were looking at a beekeeper. And the beekeeper can be a museum or a university or a school. So in this analogy, we were looking, for example, in Saragossa at Utopia, which is a place where a lot of science is made accessible for the public. The beekeepers were in Utopia. The queen bees could be a high school teacher, and the worker bees would be the students. And on top of that, of course, there's the municipality, the cities, who in their policies have a big stake. And the outcome of the project, we would call it the honey, the real valuable information that came out of the project. And we identified what we call the honey bears, people going after this honey. So this could be policymakers, scientists, journalists, all kinds. So this was the analogy that we worked on. This was also the basis of our organizing mechanism. So we came up with this model where you see that it's kind of a repeating mechanism on every level. So if you step into our project as a municipality, from this model, you can read what you have to do. You have to prepare certain things, hand it over to a beekeeper. So the first thing you have to do is find a beekeeper. If you step in as a beekeeper, the first thing you have to do is to find a queen bee, and so on. And later on in the feedback loop with the data, this is also the person or the group where you get your feedback from and your data from, where you get the feedback to take on further action. So both as an analogy to really understand our organizing mechanism, as actually a way to onboard people and to organize, to enable them to organize themselves, we use this analogy. And this is what in the end it looked like. People going around the city with the centers, using the app to know where to go to take their next measurements, seeing in the app if their data came back, and eventually in a web app that is connected to it, they could see the collection of the data and draw further conclusions, and then maybe take a next step for a next campaign. That's as short as I can make it to try to summarize our project.
Thank you very much, Evert. Are there any questions from the audience that need to be addressed now? I see a question from Elma. What is the sensor measuring? We are fortunate enough to have the builders of the sensor among us. A Spanish company called Better, let's name them and put them on the stage, because they developed the mobile sensor. Not a mean feat. It's a new piece of hardware, very sensible, very difficult to make. Sergey, could you answer this question and tell the audience what it measures?
Oh, I didn't expect to speak here. Thank you, Willem. No, the sensor measures ozone, NO2, so nitrogen dioxide, and PM 2.5. That's what it measures now.
Yeah. So 3 different pollutants, and that can be mapped in the web app and can be separated in the data for people to see what the measures are from each of these pollutants. If there's no other urgent question, given the time, I would like to go to the second project and introduce to you our friends from CitiObs. Same focus in terms of air pollution and mobilizing citizens, different strategies, different lessons learned. Nuria Castel from NILU will take you on their journey in about 10 minutes on the CitiObs project. Nuria, the floor is yours.
Thank you very much. So I'm going to present the CitiObs project. We are now finishing our first year of the project, and still 3 more years to work. So why CitiObs? So we know that policy and decision makers face urban complex challenges such as air pollution, as we have seen. And we already know that citizen scientists all over Europe and all over the world are already collecting data. We already have citizen observatories like the ones that SOCIO BEE established that are already collecting data. But this data is not fully contributing to existing observation systems like the reference stations, data from Copernicus, from GEOS, and is seldom used for policy decisions, especially at European levels where the laws are created. So we wanted to change that dynamics and enhance the role of CEOs, of citizens observatories, of citizen science initiatives. And how we want to do that? By scaling up the deployment and the uptake of citizens observatories as an integral part of inclusive multi-stakeholder governance, so putting them together with the policymakers from the very beginning. Generating validated data for policy and research that can contribute not only at local level, but also at European level. And enabling the co-design of local actions. That's very important. So here in CitiObs, we know, like by experience, that the timeline of citizens is different from the timeline of policy. So it's important that the data does not only contribute to policy decisions and policy making, but also to help, comes back to the citizens and the communities, for them also to create their own actions to protect the environment. We do have 4 main objectives in our project. The first one, it comes to have this widespread, diverse, inclusive, and stable participation of citizens, because we have seen that it's not enough of having citizens monitoring. We need to reach also the marginalized group, the vulnerable groups, in order not to create bias on where are we going to collect the data. So the data is collected everywhere, and especially where it makes more sense to be collected. We want to have citizens' observations as complementary to official observations at the different levels, local, national, and EU institute levels. And for that, we are creating these validation routines of the citizen-generated data. Also, we want to strengthen the recognition of citizens' observations as powerful for research and also for policy making. And we want to demonstrate this tools and approaches at a European level in a larger scale, as I will tell you after. What makes our project special, I think, is because from the very beginning, we are having this socio-technical methodology. And this is because we believe that having more monitoring, more sensors, better data, more interoperable, like better visualizations, that's necessary, but not enough. We need to have inclusive stakeholder engagement from the very beginning of the project. We need to get on the table the public, the policymakers, and we need, that is not easy, and we know that. And we need to create also tools that help us to create, study and understand the dynamics, create trust among them, and that it helps us to boost the citizens' observatories. But also it's important to have this leaving no one behind in the monitoring, and also to work together with other initiatives as the New European Bauhaus on aesthetics, and we work with artists, and so to make it create larger awareness, not only on the people that already understands how air quality is beneficial for health, but also together with artists, engage other people that at the beginning do not have that relationship with air quality. We aim not to reinvent the wheel. And that is like, we want to work already with other projects like SOCIO BEE and build up on what they have already been working in this great project for 3 years, and also with practitioners from the EXA communities, the amazing working groups that are already established, So in order to make sure that we bring all the knowledge that is already being done. And key and central to our project is the demonstration. And we do this with 3 phases. So currently we are working with 5 frontrunner cases. This is already cities that have citizens observatories that are established and are collecting their data. So we are working with Barcelona, with Athens, with Rotterdam, with Dublin, and with Kristiansand. And now we are just launching our 2nd phase, where we are calling for 30 alliance cases that would like to work with us in refining the tools that we are creating. And, and then we will be working later on in the project with 50 fellow cases. So by the end of these 4 years, we aim to be working with 85 cities in Europe. So a little bit of promotion here. Please join us in this exciting project and help us to refine our tools for alliance cases. And very briefly, I just wanted to tell you like what are the tools that we are working. So we have these toolkits, the Leave No One Behind toolkits, that it's aimed to make the participation in the initiatives more diverse and inclusive, and gives you tips how to do that. We also in this multi-level governance toolkits, and this is like really key to this workshop today, because how to examine these interactions between the different stakeholders, including the policymakers, and how to address conflicts among them, how to increase trust, how to strengthening cooperation about all the actors from the very beginning. Also these citizen-led actions, like we were also mentioning at the very beginning, like how we can create action for environmental protection, and how can we organize and deliver like a community and citizen-led actions that help us to protect the environment. And also like we have seen in the quiz at the beginning that a lot of people is using sensors for monitoring, and how all this monitoring can really contribute to the reference monitoring that is in some of the cities, but we still need to reduce the barriers in the use of this technology. So that's another of the toolkits we are promoting. And also we have a lot of different tools that we can provide the alliance cases that want to work with us. This is the low-cost sensors for environmental monitoring that we can provide them. Also the opportunity to make the data more accessible and interoperable, you know, like, so that is not only your data, but as Rosamund was saying, like, as also like when you can have air quality and mix this data with health, then you reach another level, you know, of making this data more usable. Also, of course, data quality and validation, you know, we always need to show that our data, the data that we are collecting, is good enough, and it needs to have this stamp. So we're working to that, and algorithms that can be provided to all the citizens observatories that wants to work with us. And also like having this decision-ready information already, like mapping this data with already existing information. So in order that policymakers, authorities can take decisions and can move forward laws and can move forward actions to protect the environment. But it's not only scientists and policymakers, the ones that need to analyze the data. We also want to promote different tools that's hands-on data for the citizens, that are easy for them to analyze their own data and make their own cases. Again, please join us in this adventure in the CitiObs. Here you have the QR code, and please just drop an email if you want to join us. We are opening now the call for alliance cases. And thank you very much from me and all our partners in CitiObs. Thank you.
Thank you very much, Nuria. And what a straight on timekeeping, may I say so. A question from the audience is, could you tell us a bit about the cost of the low-cost sensor that you're deploying in your project?
Yes, I think that this probably cost needs to be defined, like economic cost for the people that will join us. There's no economic cost. We will give them to them for free. The cost itself, like if you had to buy it, is around 300 euros.
Okay.
That's the economic, and that's the beneficial cost is a lot of beneficial cost for society. Yes.
Yeah. Now, one of the themes that we will be addressing in the World Cafe are questions around scale up and widening the scope of participants with citizens, and then of course cost factor is one of the elements that we might discuss in how that might hamper or enhance the spread of participation levels. If there is any other urgent question at this point, I would like to propose to have a short break. And we try to keep it for 5 minutes, so you can have a refreshment or change your brain for 5 minutes. But if you would be so kind to come back, we can start the World Cafe exercise where we like to hear from you. So this will be the interactive bit of the session. So 5-minute break, stretch your legs, and I hope to see all of you back in 5 after the break, as they say on television. So. And we are back live in the air. Hopefully we'll see some more people return from their little break. As human nature dictates, that it always takes a bit longer than 5 minutes to re-engage. And while we are waiting and catching up, I like to take the time to briefly introduce to you the concept of the World Cafe. We will be splitting in 3 groups around 3 teams using a Miro board to collect your thoughts and inputs on the 3 themes. The 3 themes are focusing on 3 different angles of citizen engagement and regarding air pollution. One group will start with support strategies. So how can we support citizens in challenges regarding accessibility, scalability, and what are lessons learned across this community we've brought together, what works and what doesn't, and how we can overcome some of these challenges. One group will start with data flexibility, making citizen-generated data more findable, accessible, interoperable, and reusable. This is also about standardization or accessing these themes. And there is a theme that's a group that starts with the use of data for decision-making, opportunities and challenges in data quality. What will happen is we'll gather your brains on every subject. So we'll do a rotation where we build upon the results of every group. So if you start on one theme, the next group that comes in will build on those experiences and enhance the learnings. And then the third group will come in, they pick on the brains of the first and the second group and add their bits. So it will be a cumulative process. Technically, what we'll do is we open breakout rooms and you will be allocated to a room to start on a theme. And then the themes will rotate. You will stay in this room with your group and we as moderators with our theme under our arms will switch across the rooms and thereby facilitating this process of gathering the data. And as I said, we'll use the Miro board as our collective space to gather these results so that in the end we can reflect on the outcomes and share them. So that is the plan. So we'll open up the breakout rooms shortly. There might be a bit of switching, especially when we have to rotate the moderators, so be a bit patient. In general, for the timeline, a session will be about 15 minutes, and then we close the conversation with the group. As we said, you stay in the room, and we will switch as moderators, and then you will address as a team, a temporary team, the next subject. Is this clear to everybody? Do you have any questions at this point? And if not, I think, Paul, we can start opening the rooms. And the more detail on the subject.
Willem,
yeah.
Maybe it's good to mention that the link to the Miro board is in the chat in this room.
Ah, very good. So if you have not yet accessed the Miro board, the link is in the chat. And if you're not familiar with Miro, all the elements you see on the Miro board are locked. You cannot destroy it or do anything wrong. And if you want to add a thought or a subject, you can draw a sticky note from the left bar of the application. It's the third icon on the left. You can draw a sticky note and write something on it. As I mentioned, everybody will visit all the 3 themes. Yeah, so you will be partaking in discussions on all the 3 themes, and we will rotate. So you start with one, and then the other 2 will pass by. So, welcome back, everybody. This was a frantic round the world cafe with it was almost like intellectual speed dating, wasn't it? I mean, for us, the time felt very short, but despite that hectic and frantic interaction, I don't know if you've zoomed out on the Miro board and look at the total result. That's a true explosion of input. And this is the one point in the program where we might have shot in our own foot in trying somehow to summarize these findings. So I think we are heading towards the final conclusion space. And yeah, I would like to try and invite every moderated team and see if they can at least pick out, do some cherry picking on the results, and maybe reflect on the discussions and the key topics that came out of these various interactions. And let me see, shall we start with data flexibility to pick one? Who can I give the floor?
We can try.
Johan?
Yeah.
Can you wing it without any preparation time and do some cherry picking for us?
Fortunately, it's fresh on my mind. About that, we were talking about barriers, and we were thinking about open data and licenses here, and maybe the legal and ethical issues may prevent data sharing. But on the other hand, everyone wants to democratize the data. But other people was telling me that, come on, I'm in one of these projects, and I have to provide a nice platform to keep people engagement. Don't ask me to do an extra effort to actually prepare an API for accessing the data and so on. But on the other hand, we know that we need this data aggregation, no? And some people told me about openaq.org that is actually trying to aggregate data for the global south. This is something that we are technically trying also to implement in CitiObs. We try to create a federation of data sources instead of creating a big silo. We are trying to connect the dots without breaking the sovereignty of the different individual projects there. I'm talking about data sovereignty because one of the needs that was detected is precisely to host these initiatives of having the air quality easy to get from a single place that could represent not only a municipality but also a country, and in this way maybe being used for reporting SDGs and so on. And some people, it wasn't me, I promise, told me about data spaces that could be a solution. The guy has heard about this thing about that the Commission is preparing, that is called, for instance, the Green Deal data space, where there are specific contracts to do a specific thing with data, and he was seeing that as one possibility. Another possibility that was not mentioned is the European Open Science Cloud, that could be also a hosting, because we were thinking about who is actually doing research with the data, who is actually needing the data. Are the scientists or who is there? And in one round, we were talking about that, the scientists needing to do that. On another round, we talk about citizens needing to take the lead and analyze the data themselves, and some tools that are emerging here and there to do that. Yeah. So more or less, this is what it summarized the discussion in a very long single sentence, and I'm missing many details, but you can go to the panel and read it directly.
Yeah. Well, thanks a lot for a heroic effort, Joan, of summarizing so many inputs from 3 teams. Can we go to the second theme, the use of data for decision making? And we are looking at the final conclusion space. Nuria, a quick heads up on the cherries.
Okay, yeah, I can start, and my colleagues can also say, like, so there were, like, it was blooming with posits, with ideas. So I'm not trying to summarize them all here. I think that you will get some report after, but I'm just cherry picking some of the things that were said there. So, like, this how can we use citizens' data for policy, and was like democratizing key health sensitive information, that I think it goes very much on what we were talking with Rosa at the beginning. But what are the barriers we're facing? And we were here taking this lack of trust from the policymakers on the use of citizen-generated data, and also keeping the community engaged, right? But we also were discussing about, okay, there are barriers, but there are so many benefits and advantages of using citizen-generated data and getting citizens on part of the equation. And this is data leads to action, as also enabling citizens to collect reliable data, giving what we know as a scientist on the sensors, you know, like really like closing these barriers on the use of sensors to collect reliable data, data that can be validated. And then, like, of course, local people can bring local information that neither scientists, neither policymakers can collect on their own, because we are not there where they are. Mm-hmm. How can we get this into real uptake? So there is, again, like, it needs to be this feeling of agency, understanding that the work that the people is doing does not go to waste. We need to go back to them, you know, create this agency, get done with the data that you have been collected, to keep more and more people on the move, and also overcome the reluctancy from decision makers to use non-official data. Like, and there is like again, this from the social aspects, you know, creating the right dynamics on stakeholders, but also from the technological aspects by giving this validation of the data. And I take this opportunity also for make some publicity. One of the people's joining is letting us know that there is going to be another workshop on standardization that's going to come from the amazing project SOCIO BEE and Compare. So you will listen more about that.
Thank you very much, Nuria. And last but not least, the results of the support strategies. Evert, will you try and summarize the...
I will try. Setting myself up for failure. Well, we started out with 3, I think, from the first round, really valuable insights that you that is not about spreading and scaling up, but it's about or it's about spreading and not scaling. So it's not about as many people as possible or everywhere. It's about really finding the people that you need and to empower them. And these are also the people that have questions, and that so you can work in a demand-driven way. It's not about your project, it's about the people actually performing the science and having their questions themselves. You saw how strong the first speaker today was in our personal agenda, creating a lot of energy to really make a difference. And the third one was the awareness of the diversity and the inclusion that you have to take into account when you work with so many different people who all have their own drivers and their own goals, and also the places that you want the information that you're creating to end up with or to end up are very differentiated. So you have to really always be aware of all these different things and different people, and try to include them as much as possible. What you get then, or what we came up to in round 2, is that it works better if you look at it from our experience to look at natural tribes. So this can be schools or other ways in which citizens already are organized. And that if these people don't have a natural way of organizing themselves already, then it takes a lot of effort and therefore a lot of money for the municipality to compensate for this lack of organization. So the conclusion was in the 3rd round that you either had to find or build an ecosystem. And this ecosystem is what is really important. So if you can find it, use it, even abuse it, whatever you do. Otherwise, you have to go through a lot of barriers because you have to find the money. You have to convince people of its value. Some people might still be against it because they have their own private goals that are not congruent with what the citizen science want to do. So you set yourself up for a lot of more work and a lot of more expenses if you have to build this ecosystem by yourself, but it has to be there in the end.
Thank you very much. Well, this brings us to the closure of this event. We still have in stock a final short question, I think, from Karin, to once again visit the Mentimeter.
Yeah, we said that we would send it due to time issues. We said we would send it with an email later. So
okay, so we decided to do this afterwards. If you would be willing to fill it in to close that loop. In that case, I think we can wrap up. First of all, let me thank you all for taking participation in this event. It was a great platform to be able to share our learnings and experiences. Even better to get your input and feedback and insights that we collected on the Miro. That I consider this to be a gift that keeps on giving, because we have a lot that we can digest after this event, and we will do so. I think we can agree that the story that Rosamund brought home reinforces our commitment that it is an important subject, and that we did well in picking this as a project and working on it, but there's still a lot to be done. So great many thanks for the people organizing this and supporting us, from EXA, the friends from CitiObs, our own people from SOCIO BEE. I hope it was worth your time, and I hope to see you again somewhere along the line. Keep an eye on our projects, and thanks a lot for participating.
We thank you, Willem.
Thank you,
bye.
Willem.
Thanks, everyone.
Bye.
thank
everybody.
you.
Bye-bye.
So much.
Thank you.
Bye.
Bye.
Thank you. Bye.